This month on the Taboo Topics podcast.
I always tell my patients, try for 5 minutes. If nothing's happening, then, get up, walk around, drink some coffee, come back later, but just don't linger there in the toilet because that's definitely unhealthy.
Welcome to Taboo Topics, where host Mary Frances Emmons tackles awkward medical questions with Orlando Health's top health and wellness experts, getting the answers you've been searching the internet to find. Submit your own questions by emailing the letter r-podcast at orlandohealth.com or leave a 5-star rating with your question in the review section. This podcast is produced and sponsored by the healthcare leaders at Orlando Health.
Hello, and welcome to Taboo Topics, where we address embarrassing personal health questions to take some of the stigma out of those discussions. I'm your host, Mary Frances Emmons, and today's topic is constipation. My guest is Dr. Tania Lopez. She is a board-certified gastroenterologist with Orlando Health Medical Group Gastroenterology. Welcome to Taboo Topics, Dr. Lopez.
Yes, hi. Thank you for having me. Very excited to be here.
So first, tell us how this topic fits into your work at Orlando Health and why it's important.
Yeah, so the constipation is one of the most common complaints that we have. Several patients a day and have constipation. I think it's a very important topic, and I'm glad that we're addressing it today.
So, how many stools per day or per week is considered normal? And how can you tell if you're not just a little slow, but actually impacted?
This normal is a very wide range. It's typically, we say, anywhere from 3 bowel movements a day up to 3 bowel movements a week. But really, the key is making sure that the stool is soft, that you have formed stool, and that you're not straining when you're having a bowel movement. So I think more important is the quality of the stool rather than the frequency of the stool. Now, constipation can progress to impaction. In the cases of fecal impaction, this is essentially the solid blockage of the stool in the rectum. Patients are unable to have a bowel movement despite feeling that urge. They feel a fullness in the rectum and often abdominal pain and bloating. Now, one interesting thing is that even if they're impacted, they may still see some stool. This is called overflow diarrhea. And this is really just a watery liquid stool that's leaking around an impaction. So if you're seeing this, don't think that, you're not at risk for an impaction because you still can be impacted even if you're having this liquid stool. And, what sets the pace for a normal bowel movement, it's a variety of things, particularly diet, especially how much fiber we consume. Also hydration, the amount of water that we're drinking, physical activity, and we call peristalsis, which is that natural muscular contraction in the bowel. All these together add up to determine how often a patient will have a bowel movement.
So, what causes constipation?
So constipation, essentially, the stool is moving too slow through the GI tract. So the longer it sits in the colon, the more water that's going to be reabsorbed, and this is going to cause the stool to be dry and hard. Um, Predominantly, we see this from low fiber diets and poor hydration if you're not drinking enough water. Also from decreased physical activity. Medications too can be commonly associated with constipation, especially pain medications like the narcotics and opiate medications, blood pressure medications, and iron supplements and calcium supplements also notoriously cause constipation. And it can be progressive, meaning that, if the cause of the constipation is not addressed and treated, this can continue to worsen. So as the constipation worsens, patients can start developing hemorrhoids. They can develop anal fissures, which essentially like tears along the anus. They can get what's called stercal colitis, which is essentially like a pressure ulcer that develops in the colon from the stool sitting along the wall, creating an ulceration there. It can progress to fecal impactions, and the most severe cases can actually cause bowel obstructions as well.
So, are there things you definitely should do or not do when you are constipated?
I always tell my patients, I encourage them to use fiber. However, if they're very constipated, sometimes adding a lot of fiber really fast is not a good idea. That can actually worsen the constipation. So always, go easy on the fiber and make sure that if you are going to increase your fiber, that you're increasing your hydration, making sure that you're drinking more water. Make sure that You're not sitting on the toilet for too long. Don't strain too much. I always tell my patients, try for 5 minutes. If nothing's happening, then, get up, walk around, drink some coffee, come back later, but just don't linger there in the toilet because that's definitely unhealthy. And then don't ignore that feeling when you have to go. These signals actually can weaken with time if they're ignored, and that will definitely worsen your constipation.
More on this after the break.
This episode is brought to you by the healthcare leaders at Orlando Health, where we deliver the future of medicine today. Orlando Health. Choose well.
So, speaking of toilets, what is a squatty potty and what do they do?
Yeah, so squatty potties, I love squatty potties. Essentially, it's a toilet stool that elevates the feet, so it creates a different angle from as opposed to that 90-degree angle when we're sitting on the toilet. It elevates the knees above towards the chest, so this causes the pelvic muscles to relax, and it actually straightens the rectum too. And this leads to improved bowel movements by, facilitating the bowel movement. It causes faster bowel movements actually, and it decreases straining as well. So I definitely, recommend squatty potties to a lot of my patients.
I understand that women suffer the most from constipation. Is that true? And if so, why? And who else is at highest risk?
Yeah, so interestingly, women are 3 times more likely to experience constipation. This probably from a variety of reasons, mainly from the hormonal changes with estrogen and progesterone. We have more fluctuation at time around the time of our period, at times during pregnancy and during menopause. So these changes are going to affect our intestinal motility. Interestingly enough, too, women actually have longer colons than men. Studies have shown up to 10 to 15 centimeters longer in the female colon compared to a man. This is about 4 to 6 inches longer. We also have pelvic organs that men don't have. So combined with the longer colon and that smaller space, this is going to cause what we call a tortuous colon. So the colon is going to take more loops and turns, and this can make it a little bit harder for the stool to empty out and lead to constipation. Females also have slower peristalsis, slower muscle contractions in the GI tract compared to men, and this obviously can cause more constipation as well. Other people that are at risk for constipation, so elderly individuals, they have slower metabolisms, so they're prone to getting constipated. Patients that have limited mobility or that are bedridden, either paraplegics or history of strokes or dementia. Patients with neurological diseases like Parkinson's and multiple sclerosis, they're often prone to developing constipation.
I was very interested to read that depression can be a factor in constipation. Do you find that with your patients, and what's the link?
Yeah, so depression can be a factor for constipation. Actually, depression, anxiety, and stress really all can affect the gut. And this is primarily through what we call the gut brain axis. So the digestive system has its own nervous system. It's called the enteric nervous system. And this is very closely interconnected with the central nervous system through this gut brain axis. So anything essentially that affects that central nervous system can be manifested in the GI tract. In the case of depression, it's usually associated with lower serotonin levels, and this lower levels in the GI tract lead to decreased and slower motility, so that can cause the constipation. I think depressed people tend to have more poor diet, decreased levels of physical activity, and some of the medications, the antidepressants, are associated with constipation as well.
So, what are the best home remedies for constipation, if any?
I think fiber is one of the best ones. We always encourage, high fiber diets. Again, the key, make sure that you're starting low, low amounts and work your way up because otherwise you can have more side effects with bloating and discomfort. The key also, make sure that you're drinking a lot of water, especially if you are doing high fiber diet. You want to make sure that you're drinking enough water to help push this fiber through your GI tract. Increased physical activity also helps, it stimulates the GI contractions. And hot drinks too, especially coffee, but really any hot drink can help with the constipation, as this helps relax the GI tract and also increases blood flow in the GI tract, which can alleviate some of the constipation.
Is there anything else you would want listeners to know about constipation?
Yeah, so constipation is very common. I think a lot of people in a clinic are embarrassed to talk about their bowel movements, but we deal with poop all the time. So don't be embarrassed to talk about if you have any changes, any concerns. You know your body better than anybody. So if anything's changing, anything's different, and you're not sure, talk to your primary or GI doctor and make sure that it's not something serious.
Thank you so much, Dr. Lopez, for being our guest today on Taboo Topics. Listeners can learn more about Dr. Lopez and her work at orlandohealth.com.
Thank you for listening to Taboo Topics. If you enjoyed this episode, please show your support by sharing with a friend and leaving us a 5-star review. Subscribe today to be sure you never miss an episode. This show is produced and sponsored by the healthcare leaders at Orlando Health. To find a doctor, walk-in clinic, or emergency room near you, visit orlandohealth.com.